This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Mercy Health Kings Mills Hospital offers the latest technology to help nurses be more efficient, providing the highest quality patient care possible. Chief Nursing Officer Sandra Medley shows us how the nurses at Kings Mills foster Mercy Health's culture of treating patients like family.
Hi, I'm Sandra Medley. I am the CNO here at Kings Mills Hospital. CNO is a Chief Nursing Officer, so I oversee all the clinical side, all the clinical care of the patients, and the nursing training and the growth on the nursing side. I have been here since opening and was part of the plan and the build of the hospital. I was inspired to go into nursing and healthcare when I had my first son, who was born with spina bifida. And because of that, he was admitted immediately into the NICU at Children's. And so I had to spend a couple weeks there with those nurses to be trained on how to take care of him. And so I saw them do just wonderful things, working with the babies, the sick babies, and then just working with the families. I just saw the compassion that they showed and the care that they showed, and I wanted to do that, and I wanted to be that, and I wanted to give back. We have technology here at Kings Mills that has made it very easy for nurses and for staff that are taking care of patients here to be able to do that and be more efficient. 20 years ago, I did paper, and so it wasn't as easy, and a lot of handwriting you couldn't read. So we've come a long way. What we found with COVID-19 was that a lot of families weren't allowed to come into the hospital, so they weren't part of that care of that patient. What we created here is we didn't want that to happen again. So they can FaceTime their families on the TV. If the families want to be here but they're working and they want to be here for rounds with the physicians, we can have a set time so that the family can Zoom in and be part of that conversation. One of the nice things that has helped with patient experience is that we have Kings Island, which is right behind us. And so they can go on at night at 10 o'clock and see the fireworks so that they feel that they're not just in a hospital. They're not just here and they're not just sick, but they can see a part of the outside and feel connected to that. We do a lot of training. We started training way before we even opened the hospital, so within the 4 months prior to opening. When we hired nurses into this hospital, we had nurses come, 75% were from external hospitals. So we didn't pull from the other hospitals. We were able to train these nurses at the other hospitals and then bring them here to do training of what Kings Mills looked like. So working with the president at the time, creating what we wanted to have as a culture here, and as a culture of every single patient that comes in our door is treated like our family, and that we have a work environment where people want to come and work, that they feel comfortable working, they feel supported, and that they know that leadership is transparent and they will support even on a bad day, that they're not going to go through it by themselves, that they have support from our team. So I work very hard to work with the nursing staff to make sure that they are trained and that they have what they need to be successful. Just working with them to build their skills. If there's an area that they're working in that they want to learn different skills or cross-train, we make sure that happens. We want the nurses to be happy, but if they're happy, they're going to take that to the bedside. And that's the most important thing, that these patients are taken care of every single time they come in this hospital. No matter where they are, they're going to receive excellent care.